There are various drugs used during pregnancy, labor, and puerperium. Drugs used in obstetrics have a huge impact on the outcome of both mother and the baby. Drugs used during the first trimester can produce congenital malformations, and the period of greatest risk is from the 3rd to 11 weeks of pregnancy. During second and third trimester, drugs can affect the growth and functional development of the fetus, or they can have toxic effect on fetal tissues. Here are some of the drugs that are used during puerperium: iron, folic acid, calcium, acetaminophen or paracetamol, lactation suppressants in case of stillbirth, neonatal death, breast abscess, or severe psychiatric illnesses. Let's see the drugs one by one. And to begin with the acetaminophen, the dosage is available in three different preparations: as a tablet, suppository, and oral solution. As a tablet, it is available in 80 milligrams, 160 milligrams, and 500 milligrams. As a suppository, in two different dosages, 80 milligrams and 120 milligrams. The oral solution is available as 16 milligram per ml and 80 milligram per ml. The action is to produce analgesia by inhibiting the prostaglandins and other substances that sensitizes the pain receptors. The indications of this acetaminophen or paracetamol is to reduce the mild to moderate pain and fever. The contraindications of acetaminophen is liver disease, hypersensitivity. The adverse effects are neutropenia, hemolytic anemia, hypoglycemia, urticaria. One should not forget about the dosage and routes of administration of acetaminophen. 500 milligram tablet thrice a day for 5 days can be advisable. The nurse has to consider to advise the patient not to exceed the prescribed dosage. Advise the patient to take the drug only for short term and avoid taking the over the counter drugs without prescription. Advise the patient to take tablet after meal to prevent the GI symptoms. Lactation suppressants, bromocriptine mesylate. The preparation is available as a tablet in 0.8 milligrams and 2.5 milligrams. The action being it blocks the release of prolactin from the pituitary gland. The indications: suppression of lactation, pregnancy with prolactinoma, infertility, amenorrhea. The adverse effects can lead to dizziness or lightheadedness, especially when getting up from lying position, confusions, hallucinations, hypertension, seizures, and myocardial infarctions. One should not forget to read the dosage and routes of administration. It is usually 2.5 milligram tablet orally once in a day. The nurse has to consider to monitor the patient for adverse reactions. Drugs may lead to early postpartum conception. After menses resumes, test for pregnancy every 4 weeks or as soon as a period is missed. Assess the orthostatic vital signs before initiation of the therapy. Instruct the patient to take drug with meal. We need to know what are the effects of maternal medications on fetus and breastfeeding infants. During early embryogenesis, the drugs taken by the mother reach the conceptus through the tubal or uterine secretions by diffusion. The harmful effect on the blastocyst is usually death. In case of survival, there is chance of congenital anomalies. From 2nd to 12th week, which is the period of organogenesis, drugs can cause serious damages. Gross congenital malformations and even death of the fetus may result depending on the route, length of time, and dosage of exposure. From second trimester, transfer of drugs takes place through the uteroplacental circulation due to lowered serum albumin concentration which results from hemodilution. As the albumin binding capacity of the drugs is decreased, more free drug is available for placental transfer. The metabolism of the drug may be hampered by the increase in plasma steroids, increased uteroplacental blood flow, increased placental surface area, and decreased thickness of placental membranes are the additional cause for increased drug transfer. The phytotoxic or teratogenic drugs are prescribed only when the benefits outweigh the potential risks. Prior counseling is mandatory and minimum therapeutic dosage is used for shortest possible duration. We need to be aware and known about the maternal medications with established teratogenic properties and their effects, cytotoxic drugs, multiple fetal formations and abortion, androgenic steroids, hydroxyprogesterones, masculinization of the female offspring. Lithium increased congenital malformations when used in the first trimester, neonatal goiter, hypotonia, and cyanosis. Diethylstilbestrol, vaginal stenosis, cervical hoots, and uterine hypoplasia in female fetuses. The maternal drug intake of nursing mothers have adverse effects on lactation and also on the baby as it may be present on the breast milk. The transfer of drugs through breast milk depends on the following factors: chemical properties, molecular weight, degree of protein binding, ionic dissociation, lipid solubility, tissue pH, drug concentration, exposure time. Here are some of the drugs which are identified as having effects on lactation and on the neonates. Bromides, which causes rashes, drowsiness, poor feeding. Iodides, neonatal hypothyroidism. Chloramphenicol, bone marrow toxicity. Oral pills, suppression of lactation. Bromocriptine, suppression of lactation. Ergot derivatives, suppression of lactation. Metronidazole will cause anorexia, blood dyscariasis, weakness, neurotoxic disorders. Further, the anticoagulants will cause hemorrhagic tendency. Isoniazid will cause anti-DNA activity and hepatotoxicity. Antithyroid drugs and radioactive iodine may cause hypothyroidism and goiter. Diazepam, opiates, phenobarbital will cause sedation effect with. Hence, I would like to conclude by saying that no drug should be administered to a woman during pregnancy, labor, and birth without her consent and her knowledge about the risks and relevant areas of uncertainty regarding the effects of the drug on the physiologic and neurologic development of the woman or her baby. The drugs that are used daily in obstetrics can have a huge impact on the outcome of both the mother and the child. Therefore, obstetric providers need to have a very clear understanding of the mechanism of action, doses, and side effects of the most commonly used drugs. If the contents of this video are useful and informative, like the video, share this with your friends and colleagues. Do not forget to subscribe the channel and click on the bell icon for more videos. Thanks for watching.